It's my pleasure to present the results of the Path Forward Phase 2 trial on behalf of our team, demonstrating the potential of TransCon PTH as a replacement therapy for hypoparathyroidism. These are my disclosures. And we know that PTH is a key regulator of serum calcium, phosphate, urine calcium, and bone remodeling. And it is important for us to remember that individuals who do not have enough PTH will also have inadequate levels of calcitriol, because PTH enhances the conversion of 25 hydroxyvitamin D to 125 dihydroxyvitamin D, which then in turn enhances the absorption of calcium and phosphate from the bowel and causes bone resorption with release of calcium and phosphate from the skeleton. So individuals with hypoparathyroidism have a 2-hormone deficiency. They are deficient both in PTH as well as calcitriol. The TransCon PTH molecule consists of the active drug, which is 1-34-PTH, and it is surrounded by a carrier molecule, polyethylene glycol, which is linked to the 1-34-PTH by a linker molecule. And after administration of the TransCon PTH subcutaneously, the linker is cleaved under physiologic conditions, and this releases the PTH 1-34, which will then go on to bind to PTH receptors. And the carrier molecule and the linker are eliminated through the kidney. The PK data demonstrate that free PTH levels are in the normal physiologic range with the varying doses of TransCon PTH. And so the profile is really like an infusion of PTH, and the half-life of PTH is 60 hours when it's given as the TransCon PTH molecule. The phase 2 trial design was a randomized placebo-controlled design. Patients were randomized to receive 15 micrograms of PTH a day or 18 or 21 micrograms of TransCon PTH daily. And there was also a placebo arm. And this was a fixed dose blinded treatment for 4 weeks, followed by an open label extension, which will go on for a total of 4 years. And in this open label extension, patients may receive a dose between 6 to 30 micrograms of TransCon PTH daily. The primary composite endpoint at 4 weeks is the number of patients with a normal serum calcium and being independent from active vitamin D and requiring less than 1 gram of elemental calcium per day and normalizing their fractional excretion of calcium or having at least a 50% decrease in the fractional excretion of calcium from baseline. The key secondary composite endpoint at 4 weeks are those people who have met the primary composite endpoint and require less than 500 milligrams of elemental calcium per day. We are also evaluating quality of life assessments with the SF-36. Here are the demographic and the baseline characteristics. We can see that majority of patients were between the ages of 30 and 65 years. Most of them were women, and they were Caucasian, and they were recruited from North America and Europe. The baseline characteristics demonstrate that most of the patients were post-surgical. They had post-surgical hypoparathyroidism, and they had this for approximately 10 years plus. The mean total daily dose of calcium was higher in the group receiving PTH at baseline in comparison to placebo. The calcitriol and the alpha calcidiol doses, the total daily dose was comparable to placebo. The primary composite endpoint at week 4 was achieved in 50% of the patients in all doses of PTH and 60% of patients receiving the 21 microgram per day dose. And these were statistically significant in comparison to placebo. And the 21 microgram per day arm and the combined TransCon PTH dose arms showed a statistically significant response compared to placebo at week 4. How many patients were able to eliminate or reduce conventional therapy? And we can see that 100% of patients in the 21 microgram per day arm and 82% of patients in all of the varying doses were able to eliminate conventional therapy with really no change in the placebo group. And we can see that active vitamin D was able to be reduced by week 2 and continued to be eliminated by week 4. And we can see that calcium supplements were able to be reduced by week 2 with further reductions by week 4. And TransCon PTH enabled discontinuation of active vitamin D at week 2 and enabled calcium supplement reduction throughout the 4-week period. In the TransCon PTH subjects, serum calcium increased over the baseline at week 4, while remaining in the normal range. And in the placebo group, the serum calcium decreased by week 4. The fractional excretion of calcium decreased in all the PTH treatment groups, despite an increase in serum calcium. And we can see that serum phosphate decreased with TransCon PTH, and the calcium phosphate product also decreased with TransCon PTH. The TransCon PTH was associated with improvements in the proportion of fractional excretion calcium responders. So across all 3 TransCon PTH arms, 15, 18, and 21 microgram per day, a higher number of patients had normal fractional excretion of calcium at 4 weeks of double-blind period in comparison to the number of subjects with normal fractional excretion of calcium at baseline. What was the effect of PTH on functional health and well-being? Well, this was being evaluated by the SF-36 physical component summary, and there was also a mental component summary. And at baseline, most subjects had lower than average SF-36 scores. However, with therapy, we can see that at week 4, there was a rise in the scores for both physical component and mental health component, and this was statistically significantly different and higher in comparison to the placebo arm. The treatment emergent adverse events summary demonstrates that there were no serious side effects seen with this product in the various doses, and the side effects were essentially limited to headache in comparison to placebo. So in conclusion, the majority of subjects randomized to fixed doses of TransCon PTH demonstrated independence from conventional supplements. They were able to stop vitamin D, active vitamin D, and calcium supplements. The majority of them were able to do that while maintaining a normal serum calcium and reducing serum phosphate and reducing urine calcium excretion. And they demonstrated enhanced quality of life. And all 3 fixed dose TransCon PTH doses were well tolerated with no adverse events of hypocalcemia or hypercalcemia requiring visits to hospital, emergency room, or urgent care. The trial is going to continue. The open label extension will continue for 4 years, and serum calcium and phosphate will be monitored, as well as independence from conventional therapy. The 24-hour urine calcium is being followed, as well as biomarkers, bone density, trabecular bone score by DEXA, and quality of life assessments will continue to be followed. And there will be a global phase 3 study for this TransCon PTH trial.